Hello, my name's Dr. Michelle Redford. I'm a GP and I'm going to be talking a bit about COVID-19 vaccines. So as a GP, we're getting asked lots of questions every day about COVID-19 vaccines, so I thought I would just answer some of the commonest ones that we get in practice. One of the first questions is, how effective are the vaccines that we have? So to answer that, both the vaccines that we have available in Australia at the moment are around 90% effective at preventing serious complications from COVID-19 and hospitalisation and death. So that's really important to remember. It's also important to remember that to achieve that protection, you do need to have 2 doses of the same vaccine, and those need to be given at the correct dosage interval. Another question that I get asked a lot is, can you still catch COVID-19 if you've been vaccinated? So the answer to this is yes, you can, but it is much less likely. So if you look at what Professor Michael Kidd, who's the acting chief medical officer, what he described on the 1st of August when he was talking to the press was he went through the first 2,700 cases in the current New South Wales Delta outbreak based around Sydney, and out of those 2,700 people, 15, so that's 0.55% of them had been fully vaccinated with 2 doses of any vaccine. So I suppose that gives us some real world information about the protection that you may be able to get from a COVID-19 vaccine. Another thing that I get asked a lot is, what are the reasons that would mean you couldn't have the AstraZeneca vaccine? And actually there's very few reasons that you definitely couldn't have the AstraZeneca vaccine. We are taking a cautious approach, and so if people have any of the following conditions, then we generally would not immunise them with the AstraZeneca vaccine. Okay, so one of those is a clot in a blood vessel in the brain. That's called a cerebral venous sinus thrombosis. Another one is a type of clot in the abdomen, and they've got lots of long names, but things like mesenteric or portal vein or splenic vein thrombosis. Also a condition called heparin-induced thrombocytopenia, which is a reaction to a drug called heparin, which makes your blood platelets go low. So it's not all types of low platelets, it's just that really specific type of low platelets. Also a blood clot that is caused by a thing called antiphospholipid syndrome. So again, it's not all blood clots, it's just the ones that are part of that particular condition. And another condition, which is also a pretty uncommon one, is something called capillary leak syndrome. Now, I think if you had had any of those particular conditions, then you would probably know that you'd had them, because they are all serious conditions. And also your doctor would probably know that you'd had them as well, and would be making a recommendation to you not to have the AstraZeneca vaccine. So the good news is that if people have had lots of other conditions, things like heart attacks or strokes or blood clots in the leg that are not caused by antiphospholipid syndrome, then they can still go ahead and be immunised with AstraZeneca vaccine if that's the right vaccine for them. So another thing that people often want to talk about because they have questions is this thing called TTS. And TTS is thrombosis with thrombocytopenia syndrome, which means that people develop blood clots and also low blood platelets, which can cause bleeding, both at the same time. And this is a rare complication of AstraZeneca vaccine. It happens in between 2 and 5 per 100,000 people following their first dose of AstraZeneca, and it's much, much less common than that following a second dose. It's important for people to know about, though, because it can be extremely serious, and it can also be treated if it's picked up early. And here in Australia, we've become much better at being able to recognise TTS and to treat it appropriately. So it's important to know the things to watch out for. So what sort of things are they? So one of the main things is a new and ongoing or severe headache. that doesn't go away with simple things like Panadol. So that would be important, particularly if you had vomiting with it, or you had a headache that was worse when you were lying down. Sometimes those headaches can come along with blurred vision or difficulty with your speech or feeling sleepy, and those would all be really worrying signs, and you would need to be checked out straight away. The other sorts of symptoms, so symptoms that could represent like a blood clot in the lung, would be if you had sudden severe sort of chest pain or difficulty breathing. And you can also get blood clots inside the tummy, and so that can cause new tummy pain, and people are normally really unwell with that. You can also get unusual bleeding, so with bruising or little pinprick spots under the skin, and also blood clots occurring in the leg, which could cause a swollen and sore or red leg. So these are the sorts of things to watch out for, and it's quite the list of symptoms, really. If you were not sure about any symptoms that you developed after vaccination, then there is a symptom checker available, and that can be really helpful to guide you through whether you should be seeking medical attention or not. If you did get any of those symptoms and you were in a position to see a doctor straight away, that would be ideal, and it would be important to mention that you had the AstraZeneca vaccine. So another question I get asked a lot is, can I pick which vaccine I get? That's a really good question, and I think it comes from people being really interested in vaccinations and reading lots about them, so that's really encouraging. The difficult thing, though, often is that people can't necessarily pick and choose which vaccine brand they get. At the moment, for example, in Greater Sydney, the advice is that everybody aged 18 and above should really strongly consider getting any vaccine that is available to them in a short time frame. So where does that leave people? Well, the best place to check whether or not you're eligible is to go onto the vaccine eligibility checker and to go through the questions there, and it's actually quite easy to use. It's also available in lots of different languages, and then that will tell you which vaccine you are eligible for. It does give you the option to answer the question about would you consider AstraZeneca vaccine, so then it will tell you whether you're eligible there as well. Another question I get asked is, as a younger person, should I still consider having a COVID-19 vaccination? And that's a good question, isn't it? Because, if you're young and fit and healthy and you don't have any medical conditions, it may feel like it's not very relevant to you, but I would still strongly encourage you to consider being vaccinated against COVID-19 if you're eligible. So again, you can check on the eligibility checker. But the reason for that is that COVID-19 can still cause serious infection in young people, and in some cases that's so serious that it leads to hospitalization and death. Of course, that is much less likely in younger people than it is in older people, but it's certainly not impossible. And COVID-19 vaccination is your best protection against developing any COVID-19 infection, and also protects you from being in that situation where you might pass on the infection to your family and friends. So I think what's really clear is that COVID-19 vaccination is actually really complex, and there have been a lot of changes. It has been pretty confusing and difficult to keep up with. So if you have got questions about COVID-19 vaccination and you've maybe checked out the eligibility checker or looked at some of these sites and you want to take things further and maybe have a bit more of a discussion, then I would encourage you to get in contact with your GP. That could be even over the phone or with telehealth, and they're in a really good position to guide you and to help you make an informed decision about what the right option is for you.